We are back, and this month we're talking about
menopause.
that witch. Anyway, so she's a devil. What is menopause?
Menopause is the natural decline of reproductive hormones. So your estrogen, progesterone, and testosterone. It's the natural decline of those hormones. That's the scientific definition for it. The normal layperson definition for it is when your body stops producing estrogen and progesterone, so you can't have babies no more.
I like that part. So we know that a lot of the side effects the main side effects that people complain about are hot flashes, night sweats. What are some symptoms of menopause that are not addressed, or that we may not even be aware of are directly related to menopause?
The mood swings. Definitely the mood swings is something we don't always talk about. The vaginal dryness or painful sex is something that we don't generally speak about. And the weight gain, the resistance, your body resisting to lose weight is another one we don't generally talk about. Another one we don't talk about a lot is those whiskers that come around the face, that lady mustache. That lady mustache. I ain't laughing because I do electrolysis and that's permanent hair removal because I'm not trying to be picking and tweezing. Right. So that's your electrolysis. I actually do electrolysis, but those are things that typically happen during the perimenopausal phase, going into the menopausal phase, that a lot of people don't talk about. It's kind of taboo. So yeah, the vaginal dryness, painful sex, the whiskers, the mood swings, horrible mood swings, are related to the reduction of or decline in hormones like progesterone, estrogen, and testosterone.
You brought up something. You brought up perimenopause. What is the difference between the two? Perimenopause and menopause. The difference between the two. Perimenopause and menopause.
Good question. So perimenopause is the transition from what we consider normal to menopause. It starts at about 45 years of age, and at about 52 years of age, you transition into full-blown menopause. So perimenopause is just the hormones trying to figure out what they're going to do. They're fluctuating. They're high, they're low, all of those things. And menopause is when you have not had your period for 12 consistent months. So during the perimenopausal phase, you'll find yourself not having a period for 5 months, and then all of a sudden she come back and you're like, I thought I was done with you. You're actually not. But you have to have no period for 12 months straight to be in full-blown menopause out of the perimenopause. And perimenopause, remember, is just the transition into full-blown menopause. And it starts at 45 years old and it ends around 52. So for about 7 years.
That's interesting, especially when you bring up the mood swings, because I saw where a married couple spoke about how menopause has been the cause of a lot of divorces, unaware. Like, the woman is going through these changes, and the husband doesn't understand what's going on, and it causes a whole lot of friction. So men are affected when women are going through menopause, but do men experience menopause?
So let's talk about that, because yeah, they do. And I don't call it menopause, I call it menopause. But it starts at about the age of 30, where their testosterone starts to decrease by 10% per year at the age of 30, going all the way through until maybe 65, 70 years old, where their testosterone goes all the way down to sometimes below 300, and the testosterone levels are somewhere between 300 and 800. And when they get down to like that 300 200 mark, the men start having the hot flashes. They start having anger issues, and you don't understand why they're being angry.
Oh, Lord.
Right. They don't even understand what's going on. A lot of times when women tell me that they're having problems with their husbands and they're in that 45 to like 60 level, I ask them, have you checked his testosterone? Have you had him check his testosterone levels? Because if they're low, then he is acting manic, he's acting crazy, and you don't understand what's going on, when all you need is a supplement to get him back stable and he can be normal again. But to answer your question, yeah, men go through it too, and it starts at about the age of 30. They get the male pattern baldness, anger issues, erectile dysfunction, muscle wasting, where they're lifting or exercising and you don't see a lot of muscle mass. It's because their testosterone levels are low. Our estrogen and progesterone levels go low. Their testosterone levels go low.
Don't throw your spouses away. They're going through something. And if you're single and you're going through it, you have her prayers. Anyway, that's it on the Menopause Chat, and we will see y'all later. Stay mad.